Hi, I'd like to share another interesting case of hypotony. This patient developed severe bilateral hypotony after an opacified IOL was replaced with a Yamane IOL in the right eye. Digitally, the right eye is soft and definitely hypotenuse. Whereas the left has an anterior chamber intraocular lens with corneal edema but does not feel soft. The right eye has hypotony maculopathy, and the cause of the hypotony is the immediate concern. Despite the hypotony, the angle can be visualized clearly on gonioscopy, both in the area of previous surgical trauma to the iris and elsewhere in the angle. Despite the hypotony and the surgical trauma, there's no evidence of a cyclodialysis cleft on gonioscopy anywhere in the angle. However, the UBM immediately identifies the problem. A tear in the ciliary body just above the inferotemporal haptic of the IOL. This has occurred without disinserting the iris root, hence no cyclodialysis cleft is visible on gonioscopy. Watch this space for future management of this case, and thanks for watching.